back to the title page. Welcome, everybody. We are going to be talking to you about embedding children, young people's participation in play in healthcare. And I will be hosting this session today, and joining me is Dr. Luca May Brady. We have quite an action-packed agenda, as I said. We're going to start with an introduction to participation, followed by a presentation by Dr. Brady about the rhetoric to reality of embedding children and young people's participation in healthcare. And I will also be giving a bit of a case study about how Starlight has done this. And then we have a few questions for you, but we will also open up to questions and have a discussion. Joining me is Sarah, who will be fielding the chat and will be pulling all your questions as well. If you rather just put them in the chat, and we'll aim to respond to all your questions. So without further ado, for those of you who are not aware of Starlight and what we do, we are the national charity for children's play in healthcare, and we work with more than 600 healthcare settings across the UK. And we do this by delivering resources for play and creating opportunities and events for play for children and young people who are seriously ill and or in healthcare settings. And we also do research, we do evaluations, and we have a policy and public affairs function, which is Sarah is a part of, that seeks to influence this sector and this area to create better opportunities for children to play. And we're all about children's right to play. Play is a human right. It's highlighted in the UN Convention of the Rights of the Child, and we want to promote and protect that right. But also in the UN Convention of the Rights of the Child is Article 12. So in Article 12, which is a guiding principle of the UN Convention of the Rights of the Child, it states it is our obligation to engage with children, to enable them to form and express their views and to influence our work. Now, we know from our own work and from speaking to children and young people, but also from the research, that children with serious illness or who are receiving healthcare can often spend a significant time on their own, isolated from playing with their friends and feeling like they're missing out. But we've had a number of children also tell us how lonely they feel even when they are surrounded by people, because they often feel invisible. And this is illustrated by the quote you have on the right. So this is why participation is so important. It promotes personal and social development. It is empowering because it gives agency to children and young people, and it also gives agency to those who are most vulnerable as well, who are often some of the children that you find in these healthcare settings. It helps build skills and confidence and self-esteem, and it also helps build a better relationship and a relationship of respect between adults and young people and children. And this can lead to meaningful, tangible change, because children have been involved in the decisions that affect them, and therefore you're likely to have a better impact as a result, because it's meaningful to them. And of course, we wouldn't be Starlight if we weren't talking about the play in participation and the interplay between both of them. So currently at Starlight, we are looking to build a participation strategy. And we looked at the different models of participation, and we found that the Lundy model, established by Laura Lundy, which takes a rights-based approach to participation, highlights the principles we adhere to at Starlight. And that's about making space and providing safe and inclusive spaces for children and young people to express their views, providing information and support so children and young people can have that space to express their views and have that agency and that voice, but also making sure that we take their views and opinions seriously wherever possible, especially when identifying the audience we want to communicate those views with, that can influence that change we're seeking to have. And all of that sits in a neat pink box of Starlight, where we seek to empower, we seek to do this through respect and partnership, and fundamentally through play. because there's two things here, and the interplay is that, it's important for children to participate in the decisions that affect them when you're creating opportunities for children to play, and they should have the voice and influence over what they're doing. But also, play and participation is a great method because it's fun. It's something that's important to children and young people, and they feel included, they feel safe, and it helps build their self-esteem, friendships, and social development, and improves well-being. It also can facilitate communication and encourages that participation, because through place-based methods, you can explore a variety of different things with a variety of different ages, and it helps you unpick complex issues through the modicum of play and makes them tangible and accessible and inclusive in the way that you're able to do that. So we are great advocates of participation, and I'm so excited that we are joined by Dr. Luca May Brady, who's a key expert and has done a lot of work in this space, and I'm going to hand over to her.
Thank you very much, Sandy, and hello all. It's great to see so many of you here today. And as we said, this is really about starting a conversation. So do put any comments, questions, thoughts you have in the chat, and we'll come to those at the end. So I'm a researcher at the University of Hertfordshire, and for those of you on Twitter, or X, as I can't quite bring myself to call it yet, there's a couple of tags at the bottom if you want to kind of find out a bit more about me and the department I work in. But a lot of my research is about young people's participation, both in healthcare and also supporting their involvement in health research. So I support a group of young researchers and do various co-production and participative research projects with young people. And so what I'm going to talk to you about today is some of the background, the kind of context for why this matters. So just building on what Sandy's been talking about. So next slide, please. Thank you. So I think the first thing to say is just kind of, I think it's really important to think about what we mean by participation. Obviously, in your professional life, you'll have heard all of these different people talk about co-production, people talk about child voice, engagement, youth voice, patient experience, involvement. There's all this different terminology. And in some ways, it doesn't really matter what we call it, but I think it can cause some confusion. I mean, co-production particularly seems to be everywhere at the moment, and arguably a lot of what's called co-production really isn't. And I think I think the really important thing when you're thinking about what participation is, well, we're talking about two things really. There's participation in the sense of children and young people having a say as users of services, so in the services they use. So that might be feedback, patient experience, shared decision making, all those kind of things. It's about them having a voice as an individual young person, an individual patient. And then there's what we call strategic participation, which is about children and young people having a say in how health services are designed, delivered, evaluated. So speaking on behalf of their peers. So when we're talking about participation, we're talking about both. And that's quite important to bear in mind as well. But also, as I come on to, there's different models, different levels of participation. But the two big arguments for why participation matters are impact, I think, this is really important. I think those of us who work in this space find we spend quite a lot of time convincing people that this stuff matters. And I think that was even more the case during the COVID pandemic, where it became a nice thing to do if you've got time. But actually, and also I think children and young people's health, as you'll all be well aware, kind of dropped down the agenda in terms of priorities. And what we're increasingly seeing is how important this is, because the impact of the pandemic on children and young people and their health and well-being is becoming more and more apparent as the time goes on. So impact is something that people are increasingly interested in. But there's also recognition, which I think is really important, that involving children and young people is different to involving adults. It's different considerations, different things we need to think about. And also quite often when things go wrong in the NHS, there's always a big call for more patient voice, more listening to patients, children and young people and parents. And I think another thing that's particularly different with children and young people's participation is quite often, and I'm sure you'll have experiences of this, people often talk to parents and carers instead of, rather than as well as, children and young people. And I think one of the things I really wanted to explore today and get your views on is how play can be a vehicle to meaningful and inclusive participation. But ultimately, this is about participation, making services and the policy and research which inform services better, and making sure that they reflect what matters to children and young people. And this is a report, so the Chief Medical Officer, this is when Sally Davis was the Chief Medical Officer, they produced an annual report, and a decade ago there was one focused on children and young people. So it's probably time that there was a new one, but I think this really, I think I put this in there because I think it really highlights why this matters, and that this expectation does apply to children as well as to adults. But also, again, it picks up that distinction I was talking about between individual participation and strategic participation about how services are designed and delivered. And then obviously we come to children's rights, and Sandy's already mentioned the UN Convention on the Rights of the Child, but I think it's to highlight there are two articles that are particularly key. Obviously Article 12 has been mentioned, and also Article 24 about the right to good quality healthcare and information. So periodically we have to report to the UN on how we're doing on children's rights in Britain. So this was, and there's links to all of these things in the presentation, which I think you'll be sent afterwards. But we have to report on how we're doing as a signatory to the convention. And I think what's really apparent in the most recent submission was about access and outcome inequalities. And again, talking, as I mentioned earlier, about the impact of the pandemic on physical and mental health. So I think there's a way to go. And I think, I think one of the things that can happen with the children's rights is if when you look at the articles and everyone thinks, well, yeah, that's fine, that makes sense. But actually there's a way to go in really embedding children's rights in how healthcare is delivered, and participation is really key to that. And another thing that you may be aware of, and again, there's a link to, is so the experience of care guidelines for adults came out 9 years ago. And so the Babies, Children and Young People Experience of Care Guidelines, which came out of the National Institute of Health and Care, had the experiences. So I think that's really important with this one is children and young people were at the heart of the development of these guidelines. So 4 young people were lay members on the guideline committee, and also I think over 200 young people were involved in influencing the content of the guidelines. And again, you'll see here that children being listened to, engaged, is really, really important. And so this is the checklist which was developed as part of the guidance. And I think if we click onto the next slide, yes, so the involve me element, which I think is particularly important, is about, again, the individual and strategic participation. So you can see there's a kind of thread running through here. And again, this is all really useful in terms of like understanding why this matters, but it's about individual decisions and making choices, but also planning what healthcare looks like in the future. And there's lots of different ways participation can happen. I think individual, as we discussed, but also things like groups and panels. So those of you working, a lot of you will be aware of youth forums. A lot of hospitals and NHS trusts have young people's forums, youth forums. A lot of health watchers have young people's groups as well. But there's also a lot of campaigning organisations and some really interesting young people led work, which I think is really helpful, as is approaches like co-production, in terms of shifting the balance of power a bit and getting young people to set the agenda. Because what quite often happens, I find, in a lot of participation in the NHS, is it's adults deciding which young people get involved, what they get involved in, how, where, the scope for their influence. And honestly, the scope for their influence is often quite limited. So no, that's fine. So we can go on to the next slide. Thank you. So I'm doing some work for NHS England at the moment with the Association for Young People's Health. So this is very much hot off the press as we're still kind of writing this up. But we were asked by NHS England to do some work on looking at both an evidence review and a survey to find out how young people were being involved in NHS service delivery and development. And what we found kind of echoes what I was talking about, that there's a lot of talk about children and young people's participation, why it's really important, but actually we don't really know that much about what's done and what works, what kind of approaches people are using. But also I think a sense that where there is work going on, it tends to be kind of led by adults. I mentioned terminology at the start, and there's a lot of confusion about terminology and choosing, people conflating individual and strategic participation. And from the literature, we found that, as again, maybe not surprising, but support from senior leaders is really, really key. Also, dedicated participation staff, having different ways for children and young people to get involved in ways that work for them. Thinking about payment and reward, which is quite often in research, it's very standard to pay young people to get for participation, but in the NHS, not so much. And also having really clear roles and autonomy for children and young people who are involved. And there was definitely there's a bit of evidence, and not as much as we'd like, in terms of what's hindering participation being embedded. So staff not having the right skills or enough time, some quite tokenistic participation where young people are being showcased as being involved, but it's actually not making that much difference. A lack of diversity. So what we quite often find is that the children and young people who are most likely to be using health services are often the least likely to be involved in participation. So thinking particularly about young disabled people and other marginalised groups. And also that there's a lot of anecdotal evidence about things that are happening, but very little robust evidence about the difference this makes. And so one of the things we looked at was when we did the survey is the level of participation people reported. We asked people to complete an online survey and tell us who they were working with and what they were doing. And we found quite a lot of difference informing. So going out and talking to young people, getting feedback questionnaires, doing engagement days, having chats, some stuff I mentioned, like youth forums, those kind of things, and advisory groups. But there was much less of the kind of collaboration, co-designing, and we didn't get any evidence from the survey of any co-production or young people led initiatives. So I think there's definitely a way to go in terms of shifting that and giving young people more power, more control. And overall, I think so in the survey, what we found is that participation, from what people said, was patchy, and it tends to happen in silos. So the extent to which individual attempts are successful, enduring and meaningful varies hugely. And many attempts to embed participation fail because of a lack of resources or staff capacity. Quite often people are saying they were doing it on top of their regular jobs. And again, it'd be interesting to get your views on how play specialists can support some of this and what the challenges might be to that. So I think the clarity thing was about, it was really important to start from a position of clarity about what the aims of participation, to have a clear definition of what participation means and what it looks like in practice, but also honesty about what can and cannot be changed. So not over promising, because I think that can, and also not and being really clear with young people how long change might take. We found that successful participation often relied on particularly passionate staff who are, really care about this and are willing to put in the extra effort to make it happen. And there was a need for time, in terms of capacity, and space in professional roles to take on tasks, and also for particular skills, training, support to make sure that participation was meaningful and safe and impactful. In terms of activities, it was also about having activities that were appropriate, fun, creative, exciting. So again, play is a huge potential role to play in that. So working in ways that suit young people, are flexible, and thinking about location, accessibility, all safeguarding, all of those kind of things. But I think having participation, and obviously as play specialists, that's a key part of your role, is adapting and thinking about how to communicate and engage young people in ways that work for them. So, and I think it's also that thing about participation needs to take place, what people told us in the survey, in a system where it's embedded throughout rather than being an isolated activity. So I think that's really important too, and something that's supported at all levels. so including staff, managers and commissioners. And there is also a growing acknowledgement of the amount of financial investment that's required as well. So I think that's all really important. Okay, thank you. And just a couple of quotes, there's some references later on from young people's perspectives about why this matters. And I think that's really, and I think the second quote in the red box, I think is really important too, that quite often when I've done work involving marginalized, less often heard young people think, oh, it's too difficult, they're too vulnerable, you know, they can't be involved. But actually, this is a quote from a young person who was using drug and alcohol services, and I think they felt they were really a big driver for them to be involved was actually about changing things for young people who were going to come through the services that they'd used. So I think both the young people in these quotes talk about that altruistic driver, which I think is really important. So just the last couple of slides. I won't read through this one, but you know, a lot of you may be aware, especially if you're on Twitter, be aware of the fabulous Kath Evans, who does many different things, but used to be head of Babies, Children and Young People Experience at NHS England, and now heads up the children's nursing team at Barts. And he contributed a foreword to a book that I wrote on young people's participation in healthcare, and this is a blog that relates to that. And I just really like the analogy about the magic of participation, and I think and how it can just kind of provide those light bulb moments, that energy, that enthusiasm. And I think that's really important too. It's, you know, this is all very serious and it, you know, but I think actually, and again, you know, you guys will know this better than I do working in play, but it's about making it fun and using, you know, creating that energy. So I think do have a look at that as well. I think it's a really lovely blog that she's written. Okay, so just so I won't go through all of these now, but there's a whole bunch of stuff on here that you might want to have a look at. So the Raise, the one at the bottom, is a fantastic example of a young people led piece of work. So Raise is a charity that was set up by an amazing young woman who has lupus, and it was focused on raising awareness of invisible illnesses in education settings, because I think she found that, you know, I think with somebody who has a chronic condition, it was really hard to get schools, education settings to understand what was going on, to talk to health professionals and to make sure that, you know, she got the support that she needed. And so they set up an organisation, a group of young people to drive change in this area, and they brought in adults to help them with the things they needed help with. But this is very much about young people setting the agenda, and I think it's a nice counterpoint to a lot of the more adult-driven stuff we've been talking about. And yeah, this is just a whole load of references that are in the chat and in the presentation, sorry, and other things that you might want to have a look at. Okay. And yeah, thank you very much. And yeah, back to you then, Sandy.
Thank you, Rukmay. That was amazing. And so I'm just going to talk through a case study we have here at Starlight. I've already identified various ways in which we can improve our participatory approaches just from listening to Rukmay's presentation. But one of the we are currently building our strategy around participation, and one of the things we wanted to do is to find out about children's perspectives of play in healthcare and how we could use play as a method for participation. So one of the things we did was work with our health play champions. We have health play champions across different healthcare settings across the UK, many of whom are health play specialists, and we worked with them to identify different playful approaches where we could give the space for children to voice their views and opinions and talk about their perspectives of play in healthcare and what they would like to change. In future, we will be working with children and young people to develop those methods as well. But what we ended up doing is create a multi-method participatory play toolkit that was sent out to around 40 different settings across the UK. And we provided, and with the support of Health Place Champions, we ran those activities and collated all the views and perspectives of children and young people. And it was quite heartening because the way that all the information was shared was via photographs and videos and things like that, which was like amazing to see all the information coming in. We also included different ways for our health place champions to also interpret what was going on and look at children and young people's engagement. And we included the Leuven scale in that. But what we found is by creating these different toolkits, the health play champions that did feedback to us said that that had a huge impact on the children and young people who took part. It improved their well-being, and it even was a great distraction from what they were doing. They were having a lot of fun. So what we will be doing is taking all the information that was shared with us and using that to inform our policy work, to inform our research, but also to inform the development of our services. But we will also take stock of what we did to improve how we do this in future. But we've got a lot of plans. We're planning to develop a strategy, as I said, and we can share that. We will be setting up a youth panel, and we will be looking to you to help us advertise that and engage with different groups of children and young people. And we are also planning to create a network for a wider group of children and young people, so they can also participate in the work and engage with the work that Starlight is doing. And we hope to create better and more participatory events in future. So, as Luca mentioned, we have a number of questions for you, and we're also interested in hearing your questions, but we would love to hear about examples of participation in your work and in healthcare, and also to hear about how do you think that health play specialists and other professionals could support children and young people's participation through play, and what would enable that to happen, what are the barriers that get in the way. So I will open up the floor. I don't know if Sarah has any questions or if there are any hands.
There was just one comment in the chat earlier, which Luca May has responded to, but it was from Triona in Manchester on the importance of nursing staff endorsing participation and not just the play staff.
Mm-hmm. Triona, do you want to elaborate on your experiences of that?
Sandy, I'm wondering, could we, I'll put the questions in the chat, and then maybe we can turn off the presentation.
Hi, sorry, it was me that wrote that comment.
Oh, hi.
It's just, yeah, it was more to say that things that we would share with each other as a team, it just, once it's mentioned by a matron or one of the nurses, it kind of gets taken a little bit more seriously. But I feel since the You're Welcome and the youth forums are more widely spread now, and there are nurses on those panels now, we're working much better together to get our point across. It's just unfortunate that people weren't listening to us originally.
Mm-hmm.
That was it, really.
Yeah, that's a very good point, and I'll put a link in a minute to the You're Welcome quality criteria in the chat, because I think that was recently relaunched rather quietly, which is quite interesting. I think I'll put I think the Association for Young People's Health did something about that. So for those of you who aren't aware, the You're Welcome quality criteria for youth-friendly health services were originally published in 2007 and were relaunched earlier this year, but it was a bit odd, honestly. They kind of, I found out through through the Association of Young People's Health on Twitter that this has happened. So but yeah, I think being aware of those things is important. But yeah, absolutely. I mean, I think, you know, it came through really clearly from the work I've been doing with the Association for Young People's Health for NHS England, that the kind of time support for this and recognition that this matters is really important. I think there were lots of people lots of frontline staff who are really keen to do this and really keen to support this. It's just, making sure that people have the support to do this. And what are your thoughts in terms of the role of play specialists, play roles in facilitating this? How do you think it might be possible?
I think part of what you were mentioning is that maybe that the role of play specialists is not being recognized, and actually they've got a central role to play. Did I understand that correctly? There's also a comment in the chat from Emma that says sometimes we find that children and young people don't want to participate all the time in feedback, as sometimes it can be overwhelming, and all the different feedback that is wanted during patient's admission. So
I think that's a really, really good point. And I think, there's a danger of, particularly since I think because of the focus on health inequalities and marginalized young people, about young people kind of getting over consulted or being asked a lot for feedback. And I think one of the biggest things that seems to switch young people off is being asked for feedback all the time and then never seeing anything change. So I think Peter Beresford, who does a lot of work around participatory research, has written some really interesting stuff about people also having a right not to be involved. So I think that there's two kind of really big things for me in that. The first thing is, to be aware of not over consulting and realizing that especially young people who are in hospital who are unwell might have other priorities, other things going on, but also about making sure that any participation that does happen is meaningful, is impactful, does actually make a difference, and that the difference that it's made is fed back to the young people. Because I think one of the ways they really switch off is when they feel like they're being asked to fill in forms or give feedback all the time, but nothing changes. But yes, so Emma, you had your hand up.
You're on mute, Emma.
Hi. Did you mean this, Emma? Hi. So just a couple of things I wanted to come in at. I have been working for about 15 years. I'm a musician and I work across a lot of different healthcare settings, but children's hospitals as well and hospices. And there were just two things. First of all, that I really hear what you're saying about the feedback when children are poorly in hospital can be very difficult. So I don't know if there is any room or feasibility to collect that kind of information once children are hopefully better and home, that can be followed up. I know things can get lost in the busyness of life, but that might be one approach. And the other thing you mentioned about being valued as a play worker or support, and whatever guise that is. And I know, because I freelance for two well-known organisations who are constantly up against the wall in terms of funding. And actually, I was having a conversation last week when I was in a children's hospital with nursing staff who said, how lovely they would like to have somebody to come in on a regular basis rather than 2 or 3 times a year. So I think it's that whole recognition within an already strapped for cash NHS that this kind of enhancement has a really profound effect, not just on the patients and the children, but also on the surrounding family in terms of relieving stress, particularly when I've worked on lullaby hour and things like that, in highly stressful situations, and the kind of the wider group of people that are impacted, could be staff on the ward. So it's raising the recognition, and I'm sure other facilitators who are listening today would agree with that. It's quite difficult to I've been doing it for 15 years, but to keep going year in, year out when there isn't actually that particular role within health. It's all charitable funding.
Absolutely, and part of it is, as you're saying, being strategic to kind of like minimize that burden and not having to do all those things all the time, which also then is more effective in terms of the use of resources and time you spend on all of these activities. Next week we will be talking about our work from the task force, I believe, Sarah, and about us really creating that recognition. And I would recommend everyone to go to that task force. But building on what you said, there was an interesting example included by Kirsty in the chat, and I would love you to elaborate on what you've included, and how does that, what we've discussed so far, fit for you in terms of managing that with the funding, with the capacity of staff, and so forth. Or okay.
I mean, I
didn't mean to put you on the spot, Kirsty.
That's fine. I mean, I think if you do put your hand up if you want to kind of come in or elaborate. But I think, I think there's some really fantastic examples in the chat of what people are doing, kind of, at the kind of individual level in terms of how a lot of you are working with children and young people to make sure they have a say. But what about, one of the other things we're talking about is the strategic participation. So, how do you think play specialists could have a role in supporting participation at a strategic level, so kind of deciding how services are designed, delivered, evaluated? Do anybody know of any play specialists, say, working with NHS youth forums or getting involved in other ways? Yes, Emma.
Yeah, sorry to just come in again, and I won't keep coming back.
Not
but
at all.
I just completed a 12-month study that which is exactly about this, and it was working in mental health, actually in adult though rather than child, and it was all about how at the end of each session and how we could integrate into each session meaningful feedback from patients about what they enjoyed, what they didn't enjoy, how it made them feel, what they would like to see going forward. And it was looking at really how to develop that in terms of not just being given a sheet of paper. So maybe as musicians, whether we could use a song to kind of get that information back, and it could, or so looking at other mediums rather than just a sheet of paper that you would tick. So that might be visual aids, it might be putting it into the play. And I mean, I appreciate I'm talking about a very specific type of feedback, so rather than a standalone group, this is something that happens during the actual sessions themselves. So maybe greater integration of that. It was the Sowerby Fund who did this, and it was a piece of standalone research that I did as part of a steering committee with Music in Hospitals and Care, if you know that organisation. So it involved clinicians as well as musicians who were going in, and we kind of brainstormed as to what would be the best way to get that information.
That's a fantastic example, and it's another reason why having sort of play staff involved, I think, people with play expertise is so important, because it's definitely, I think, using creative approaches is is such a great way to get information and to engage young people. And I think, Paulina, you've put a really fascinating, I think as somebody who does a lot of participatory and creative research, I was really interested in what you put about, how those kind of methods work in terms of getting children's perspectives for evaluation and research as well. So could you say a little bit more about that? Oh, sorry, I just saw the bit underneath that said you can't talk because you're in a shared space. Don't worry.
I think you asked interesting question. Oh, sorry, go on, Paulina.
Just quick question. Can you repeat the question, please? Sorry, because
I just want to know a bit more. I think because we were talking, I think you wrote something really interesting about how using creative methods and play approaches can be really useful in terms of getting children and young people's perspectives. So from the research that you're doing. So yeah, just be lovely to hear a bit more about that.
Well, currently this is my PhD research, and I'm doing hospital ethnography, and right now I'm in 250 hours of observation. So one of the many things is that I've been able to follow the children around and write what they say, and even just like sometimes they look at me, it's like, why are you following me? And I tell them, like, I'm writing stories about children in hospital, so I'm getting a lot of what they say, or they say to their friends or to their family or between them. And many of them, when I tell them, can we sit down and have a chat, and I want to, like, we're gonna play, and I play with them, and we do drawings and stuff like that to see if they want to share a little bit. But I ask questions, and they're like, I don't know, and it's very hard to get like an opinion, or also the camera. I have lovely videos of the children just in the camera, like blah, 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 blah. But without the camera and without me trying to actually get information, they just share, or the way they behave. So I think that's one of the things that I'm getting through observation, and how not only how they react to the play team, but also how they behave when someone approaches their bed, and all the things that many of them, I follow them for 6 weeks, and then we do the interview, and what I've seen is completely different of what they are saying. And many of the things that I've seen, I ask them and they don't remember. So I think it's very important that we keep doing this observation, because I know play specialists have an amazing capacity to observe. So I think that maybe we could do some qualitative research with all the data that they could be gathering with specific, I don't know, like if they're preparing for surgery, write their observations and stuff like that. I think observation is key for, and especially the little ones.
Yeah, and I think, sorry, Luca, and it would be really interesting to hear from any play specialists in the audience to think about, like, you know, the things that you do where children do share information with you and talk about their views and their opinions, and what happens with that information and how that is communicated, because that's like what you're saying, Paulina, that is participation happening. It's not about asking key questions or giving forms and things. It's naturally in the child's environment getting that feedback and having those conversations.
I think that's so important, and I think it's when we're talking about kind of strategic participation, things like that, I think there's definitely, play specialists could have much more of a role than they do. I think having, you know, seen how NHS youth forums work, how young people get consulted and engaged, I think that it's not, and I think that will be really interesting. I think Sandy and I have been talking about potentially doing some research on this. So yes, Nicola, you had your hand up.
Just going back to what the last lady was saying about, like, the children and the input that the play specialists have with us, is that they see us as non-threatening people, because we're not in blue generally. Anybody that comes to them in a, you know, a nurse or a doctor, they see them as threatening because they come to do horrible things, but they have more trust in us a lot of the time because we don't do anything horrible to them. We're the fun, nice person, and, you know, and something, we're the one that they look to explain in a manner they can understand, you know, and they kind of have a more trust in us, and we're more of a safer person, I think they feel a lot of the time, to confide in. And again with the parents as well, they feel that if they talk to us, that it might not get looked upon as, you know, frowned upon. When they say something to the nurses, they feel that they're inadequate, or it's frowned upon really as a qualified HPS. That's my opinion.
And that shows how important the role of the health play specialist is, and that's why it's so surprising that they're not health play. From what I've understood so far, and if anyone has any other examples, because I think Luca May did put that question in the chat, that play specialists are not involved in the youth forums and things, because that seems like a natural place as well to be part of those discussions. And so if there's any examples of that, it would be great to hear about them, because it's so, the skill set you have and how you make people feel at ease and stuff, that is what enables participation to happen. It's so important. I'm just going to pass over to Paulina, or unless you want to come back on that, Nicola.
No, I agree. I think the role that we do within the hospital setting needs to be actually more explored with the wider community, because it's not until children come onto the ward that parents don't even understand that our role even exists still. It's still quite alien to a lot of families that come on the ward for the very first time and don't know what to expect. And, you know, again, you're building, you know, I'm full-time on my surgical ward, and it's surgical medical ward, you know, and we see a lot, you know, and the expectations is massive from the nursing team for me as a single person on my ward a lot of the time.
Yeah. And we need to still continue hitting that drum and say this is so important, and because that's the main barrier, isn't it?
General hospital needs to be much more publicised, really, in the role that we do and we facilitate, really. I mean, publicly, I think Starlight could, need to get out into the big wide world and like advertise more, and not just within the hospital environment, but also like in schools and things like that. So when they come into the hospital environment, they actually know that they're going to see somebody, not just a doctor and a nurse. They're actually going to see somebody that's in a different uniform and can do different things and bring a completely different aspect to the table.
Yeah, absolutely. And we're trying, but we'll keep coming back to you to see if we're doing a good enough job. I'm going to pass to Paulina now.
Quickly, just of course I have a zillion things to say, but I'm gonna try to keep it short. But for example, Nicola, you just mentioned that the children, like, they learn to, like, they trust you and they identify you and they can make the difference. But many times I've seen like the complete process by following the children before they meet with a play team, and how they discover that a play team exists, and how they start building the idea of what they do, and also what do they understand of your role, because many times they will refer to the play team as the doctors as well, and the role of sometimes they don't know what's the role, but sometimes I ask them, it's like, sorry, but you know what's her job? And they're like, going to the cupboard. And also I ask, like, so you know what's her role? And they're like, talk to me. So it's a little bit of very, very interesting of how they react before the play team arrives, while they're there, but also the things that they say and the things that how they start building the different members of staff and all that process. So I think it is very important that we focus on all the things that you share, because the play specialist I've seen, the people is like the staff member that knows the children the best. Like teachers will come and ask, like, I'm going to leave more homework. And the play specialist will be like, no, she hasn't finished the homework from yesterday. And I'm like, why? Why they know so much? So it's like, of course, I can say a lot of stories, but it's like, this is a little bit of what you're saying, Nicola, of this relationship and how it's being built. And also, as you say, Sandy, how important it is to get the play specialist on these forums, so they can say exactly what the child is about. Because I say, like, the healthcare assistant is there to take the blood sample, but the play specialist is there for the child. And that's in the to-do list is the child. So I'm going to stop.
Yeah.
Have
Sorry,
more
Nicola,
time to invest with the children when they're on the ward, and I think that's how we become, like, sometimes, like, if they're in for a long time, I kind of joke and say I become your new best friend while you're in hospital, because you will see me every day, and I seem to have that impact on their day, and they look forward, they can hear me walking up the ward or laughing or talking, they're like, oh, Nicola's in, we're gonna have a good day today, and it's that impact that you have when you first meet them. And again, it's how you introduce yourself and introduce your role to that child and that family when they come in. If you introduce yourself as the play lady, and I sort of say, yes, I facilitate play, but I also do lots of other things as well. I'm not just here to play with you or facilitate. I can facilitate your play. And if I've got my day allows, we can have some time together, but also I do lots of other things as well. And I think it's really important to say that.
Absolutely. And also for the medical team to be other health professionals to be aware of that, because I've done site visits, and there was this one consultant that just kept on following the play specialist, asking where the remote control is, and it's like, that is not what that person is there to do. It's about recognition, and the whole the healthcare staff or the health professionals knowing exactly what that role is, and being able to promote that as well. There is a mention of RMCH having play team members in the youth forum. I would love to hear a bit more of that if someone is willing to share. No pressure, though.
And I think, Sharon, you've got your hand up as well.
Oh, sorry, I've missed that.
I don't know whether. Hello, Chris. Can you get behind you? Hi, Chris. Come on.
I think there might be two microphones on there.
Hi, it's Sharon and Gillian from the Ulster in Northern Ireland. Yes, it was just to feed into, over the years, in order to get kind of views of children and young people in hospital and to use it to try to improve our services, we would have developed really simple questionnaires that they could write or draw their responses or just tell us them. So the child one that was for children typically primary school age was tell us one thing you liked about hospital, tell us one thing you didn't like, and what else would you like to have in hospital. And then the adolescent questionnaire we used years ago when we were doing research, and we'd done like an adolescent focus group as well with young people who used the service, and it was a multidisciplinary research group we used as well when we were trying to enhance facilities in our paediatric for adolescents. And we made a questionnaire in accordance with the like quality guidelines at that stage. And one of the other things that we have done in the past was do like speech bubbles, where we had like a display board when you came into the ward that had patient children or young people's, you know, thoughts about hospital. So they could have written or drawn on those, or sometimes they might have made a model just to try to use some other creative element. But quite often we would find, even in our day-to-day, Gillian's here too, in our day-to-day interactions with children and young people, things about their feelings that come out when you're just working with them, even doing normalising play and the therapeutic play. And then it's just trying to make a point of communicating them to the staff or making a note of it if you feel it's other ways. Or sometimes even if we're trying to build up resources, we will say, look, let us know what things would you in hospital. We have maybe a wee bit and we want to try to buy some things that we think are really in for your age group at the minute. And then we're asking them to help us and sort of frame it that way. And sometimes then they're pretty receptive to that as well. Thank you.
And that's a great example of, you know, what we were talking about, the Mundi model, about, you know, creating the space, having the voice, and then identifying the audience and trying to influence it. We've got I think I've got Joe, but there might be somebody in the number of the hands. There's a number. Oh, Sharon's I think is next. I don't know if your hand is a legacy hand, Nicola, so I'm going to go to Sharon.
Keep it on Sharon's.
Hi, Sharon. Okay, I'll go to Joe.
Hi, it's Chris. I'm one of the play specialists here at Royal Manchester Children's, involved with Youth Forum.
Hiya.
What was it that you'd like to hear about?
Well, what do you do?
How?
What impact does it have? Everything, really.
So we have Youth Forum the second Tuesday of every month, and there's a team of us. There's 2 play specialists and a play leader about to come on board, and we work alongside the youth workers. And what was your name?
Mary is a nurse in transition, a senior consultant, but she's also a doctor, so she covers transition really for young people.
Yeah, and throughout the meetings we discuss a range of topics. Youth Forum play a massive part of giving their opinions on different projects. We also go on a walk around each month on a chosen area, so we go to a different ward or a different department, and the Youth Forum will do a tour, and then we'll come back and feedback about how they feel about the facilities, following the You're Welcome guidelines. So the standards of the You're Welcome is what we follow for that. So yeah, it's good, really, really good. Very we have lots. We have an age range from, probably the youngest is about 13 at the moment, the eldest probably being around 19 years of age. And we go across MFT, so that's the Manchester Foundation Trust. It's not just at the children's, we go into adults as well, where there's young people areas. So very good, very enjoyable.
lots of knowledge. The youth forum are amazing, as you do when you get first-hand opinions.
Mm-hmm.
They're very honest. They're very kind and very productive.
And what happens with the information that then you take forward to the key decision makers? Like if they raise anything that they would like changed, is that well received?
Very well received. So we feed back to that wherever they've done the walk around.
Mm-hmm.
They feed back all the points that they want to feed around, and then at the next youth forum, so the month after, that department come back and discuss their feedback and what the changes they've been able to put in, or whether them changes are not possible and for what reason. And they're welcome to come back at any time. So if you've not made those changes or developed anything within that month that may have been on your feedback, you can come back to youth forum at a later time when you've been able to, and you can always request a visit as well for them to come at another time if there's projects you're working on and you'd like their opinions and stuff.
We also as well work closely with the youth workers as well. We've recently got them at our trust, and I found personally for the young people that I'm working with, it's working really well because they are already following through in clinic appointments and things like that. But when they need preparation for example, for like a blood test, we've done a session together so that she knows that she's got the youth worker there for support for if ever I'm not there and to follow her through in clinic. And then also we've got that good team network as well. So that works really well, and they open up to us as well because they know that there's not the doctors and the nurses around, and then we can be that young person's advocate in a way. So that's working good as well. And like Chris has said, they attend youth forum as well.
Amazing. I would love to come and get in touch with you guys to find out more. But we've reached the end of this session. I wish we could continue chatting because there's so many great examples in the chat, and you've talked about so many great examples that what we might do is pull all that information together and share it as well. And maybe we can start creating a network of different approaches and learning between us about different participatory approaches, and where we can ask each other questions as well, because I found that this was, for me, I've learned so much from all of you, and I really thank you. We will be making this recording available and the slides, and there's information on how to contact me or Luca May or anybody at Starlight, really. But yeah, we really appreciate it. It was so lovely hearing from all of you and having this discussion, and I hope this has been useful as well for you. So thank you very much, everyone.
Yeah, and thank you. I think it's thank you for your fantastic examples as well. I think this definitely feels like the start of something we need to explore further. So thank you so much, Sandy, for inviting me as well.
Oh, no, thank you, Luca May, for your amazing presentation and your involvement. Thank you, everyone. So much love. Okay. Bye.